So thank you once again for joining us. It's great to be back with you. My name is Hynd from the Guide Liverpool. Of course, we're live streaming another discussion, another mayoral Q&A with Liverpool City Council, with Mayor of Liverpool, Joe Anderson, and something different this time. A couple of weeks ago, we spoke about gyms. You might have watched that one. We also spoke about Tier 3 restrictions as they were enforced. This time we want to talk about something really important, and this is mental health. We're all going through our own battles right now. We're all on a different page every day. We've all heard that term Corona coaster. I know I've certainly been up, been down as the weeks go on. I'm sure you have as well. Just trying to make sense as to what is going on during this crazy year. We got some great people, a great panel with us this evening, who are going to give lots of advice for you at home, if you're watching, if you're listening. Some great advice for you coming up over the next 30 minutes. We're joined by the team at Merseycare. We'll tell you exactly what Merseycare is and how you can get help and support if you need it. We've got Salome, who is a mental health practitioner within Merseyside. We're going to be talking to her about her job, and as well Hope Virgo, who's a campaigner, a mental health campaigner. You might have seen her online, I'm sure you have, a lifestyle blogger, and she does some great work around eating disorders. So we'll talk to Hope a little bit later on. To start with, though, we're going to start with Mayor of Liverpool, Joe Anderson. Joe, you know, to you spoke about mental health before, and we know how important you see this subject. I asked you this a couple of weeks ago. What is it you want people to take from this evening?
I think just to listen to people and understand that people are here to talk to you or your family members or friends or relatives that you might be worried about, because I think everybody understands and recognises that you just talked about it, saying Corona coaster, and everybody, I think, understands and realises that I don't think anybody's going to get through this in a way that you know, classes themselves as not being affected by it. I think everybody, in one way or the other, is going to be affected and touched by it, whether it's as an individual or basically through somebody having, you know, lost a family member, seen somebody suffer with coronavirus, and also, you know, the stress, the pressure, being furloughed, losing a job, being made redundant, not being able to cope and manage because of loss of income as a result of all of those things. So somewhere, everybody will be affected. And so it's about communicating, talking, listening, seeking advice, and just being able to actually know that people are out there willing to talk, willing to help. So that's what I want people to get out of tonight, really. There is no immediate solutions, there are no immediate fixes, and I don't think we're going to get that, and I think people are going to probably struggle for a long time after coronavirus. You know, we get a vaccine, and still people will still feel, you know, in some senses, you know, hurt and affected by what they've been through, whether that's, as I said, the loss of bereavement, or just going through the stress and the anxiety and the pressure that COVID is putting on us.
Okay. Joe, obviously we know you as Mayor of Liverpool. We have done for many years. We see you on social media. We see you on the news. We might not see, you know, your personal life often and what you go through away from the Liverpool City Council role that you've got. You know, just 10 days ago, you went something really sad. You lost your brother to coronavirus. We see on social media, you know, sometimes some quite negative comments towards you. That's stuff that you've got to deal with personally. How do you cope? How do you put it aside and do the kind of work face against the personal face?
That's a good point in a sense, Jay, because nobody understands everybody entirely. You know, even your closest friend, relationship partner understands or knows you 100%. And, you know, I guess because we're talking about mental health and the impact of mental health, you know, it would be very easy for me to say, oh, I dismiss the things that you know, are said about me and the comments that are made about me. Of course they hurt. You know, they hurt me. They hurt me personally. They hurt my family. They hurt my sons, my daughter who sees it, you know, and reads it, and some of the things that are said, you know, are distasteful and you know, just insulting. And so when you're doing your best and you're trying your best, and that's all you're doing, because you know everybody in life will make mistakes. And I don't get everything right all the time, but you know it does impact on me, not just because of the you know the side of it that sees the abuse and the insults that you get, but also the fact that you have family as well as the job. And you know I'm proud of being the mayor of Liverpool, leader of Liverpool for 11 years, to really tough times, and I've been involved and engaged with many things that have affected our city. But you know you do have your own you know, challenges and things. And as you just rightly said, I've lost two brothers in the last 7 weeks. You know, my son was diagnosed with cancer during COVID, and he had radiotherapy for 16 weeks. And I couldn't be with him, couldn't go with him, couldn't talk. You know, well, obviously talk to him, but couldn't hug him, couldn't cuddle him, couldn't be with him, couldn't support him. You know, I've got relations in care homes that have been placed in care homes that I couldn't see and can't see. So all of those things I know are happening to other people. For me, it sometimes I get, you know, days where I want to stay in bed. I don't want to get up. I don't want to go out. I just want to feel, you know, left alone. But I think deep down, I know that you know, I can't do that, and so I'll force myself out and about, and whether it's to go into work or to pick up the cudgels and start dealing with the amount of things that I have to deal with. So you know, you get on with it. But I know my family's my family in its immediate sense, my sons and daughters and the wife. You know, Marg was working. She's now just retired as a nurse, but she was going into hospital and working on COVID, you know, with COVID patients, and then coming home to me, and I was shielded. It was all the stress of that, all the pressure of that. So you just have to get through it, Jake, from a point of view. But I think I've got through it knowing that I've got that family support, the wife who, you know, I couldn't manage without, there for us. And that's part of the issue for me, and the worry I have about people who haven't got lots of family support and lots of siblings or brothers or sisters or wives that they can rely on. That's a concern.
Joe, well, I mentioned then social media and some of the negative comments that we do see, and you know, I know your daughter Joanne, and I always think, how does Joanne feel reading some of these horrendous comments? When your brother died, and it was obviously a terrible day for you, and really sad for people to read, you had an outpouring of really lovely comments from the city of Liverpool, and I was made up to see that, because I thought that'll do Joe good, reading that people have got us back. And we've just had a comment from John on Facebook just saying you're doing a great job leading us through the crisis. So hats off to you, and I think I can talk on behalf of the majority of people in Liverpool to say, you know, we felt it when you lost your brother just 10 days ago, Joe. So thank you, you know, John, again. We're going to move on to Merseycare, Joe. I know that you know all about this, and we've got Michael with us, Michael Crilly, Director of Social Inclusion and Participation. Michael, just tell us what Merseycare is, because it's something we see all the time. We don't quite know what it is. Tell us what Merseycare is.
So, Jake, Merseycare is basically the mental health and community organisation, NHS organisation for Liverpool and Sefton. So the full range of mental health services, from high secure forensic care all the way through to community services, nursing, dementia services that you'll see across the city and beyond.
So what help now if someone is watching this right now and they're feeling the strain due to problems linked with 2020? What would you say to them, and how would you direct them to get that support?
I think there's a huge amount of support that's available there in the first place. I think to say, and I know Salome's going to talk a lot about the clinical services that are out there, but I think what the Mayor's story illustrates beautifully for me is that actually there's absolutely no one in any time or age who isn't touched by the impact of mental ill health. It happens to absolutely every one of us. You know, the statistics say 1 in 4. It's nonsense. It's all of us. We have those peaks and troughs at different points in our lives. And the other thing that comes out of what Joe says is that there's nobody similarly who isn't touched by COVID in a deeply personal and intense way. And those two factors of the reality of COVID and the reality of us all having a mental health that needs to be cared for is just key to this conversation for me. And it's how we can actually begin to help people, almost give them permission to talk about it, to find some of the language, to identify some of the stresses and strains, and then make them aware of some of the tools and services that are out there for themselves. So some of the services I'd like to talk a little bit about today relate to not so much what you'd normally associate with the NHS, not so much the clinical services that are out there across our city, but the social, the human, the pastoral and the emotional and the practical. One of the things we've seen throughout the pandemic is the huge stress and strain on people in terms of social isolation, impact to their financial issues, how they're going to get food, how they're going to get medication that they need to live, how they're going to stay connected with their loved ones, a whole host of normal everyday things that too often are taken for granted. But for a huge swathe of our population, they're just not supported. So one of the services that Merseycare launched 5 years ago that has become increasingly relevant in the last 6, 7, 8 months is a service called the Life Rooms. So within the Life Rooms, we have a range of support options that aim to get upstream so that it isn't about actually accepting this inevitable descent into crisis that you've got to end up in clinical services. So through the Life Rooms, there's a whole host of support that's available to people to learn how to manage their own health and well-being. You know, we've had a huge campaign of staying well, staying home throughout the COVID spike. We've got now in excess of 70 digital courses that people can access online through the Life Rooms platform to look at how they might understand and manage anxiety, self-esteem, their confidence, the whole range of issues, and also things that may help them take their mind off some of the realities of COVID. You know, it's a hell of a thing to be living with constantly this and it being on your mind all the time. So there's a huge program of learning that's available through the Life Rooms platform at Merseycare, but also there's a whole team of people over the phone now available to support people with those practical issues that may be impacting how they're living, their housing, their debt, their benefits, the emotional support that they need, social isolation, just the human connection that they need. So that's there, that's available. I think one of the key things we're very aware of at the minute is the impact that social isolation is having on people's mental health and well-being, and particularly on how that may impact potential for suicide across our city. You know, we've seen the suicide figures increase dramatically over the last 20 or 30 years. Inevitably, COVID is going to have an impact. So one of the things I'd really like to make people aware of tonight is the Zero Suicide Alliance that Merseycare coordinates. It's a national movement made up of all sorts of organisations across the country. And now nearly 1.5 million people have undertaken the online suicide prevention training that the Alliance has produced. You know, 20 minutes, really simple, really accessible, but you know, it's 20 minutes that could save someone's life. And we've actually developed that training still further in the last 6 months in response to coronavirus to help people begin to manage social isolation, to think about how they might have a conversation with somebody that they're worried about being isolated, who might take their life. So I think those are really important services that are available to people right now. And I guess the other thing for me to say on behalf of Merseycare is you know, it's not just about the statutory services that either the NHS or the council provide. We are so fortunate in this city with the full range of voluntary sector services that we have out there. We have our Live Well directory with a whole host of resources people can access. We have an amazing mental health charity, Imagine Independence, which is launching Merseyside Mental Health Awareness Week next week. They've a fabulous new initiative called Building Up Stronger, focusing on some of the poorer and more socially challenged and deprived areas of our city. So there's a whole host of stuff that's out there socially. I think whilst we've got to have great clinical services, I don't think anybody in Liverpool, I think this is a really important point to make, is prepared to accept that crisis has to be inevitable. There's things we can do to get ahead of that crisis, which will make life better for people.
And all that help is there now, and it's all free as well. We've got to say. So if you Google now, life rooms, for instance, that website is fantastic. Zero suicidal line as well, and just stuff on the Merseycare website. Are enough people using these resources?
Oh, totally. I mean, it's been through the roof throughout the time. I mean, even prior to COVID, we had footfall of around 5,000 people a month in our life rooms, the physical buildings. Now, the fact that we've gone into a digital outreach has probably increased that dramatically. So we've had, 13,000 people accessing the 80 odd digital courses that we have online through our YouTube channel and our platform. We've had in excess of 12,000 social prescriptions generated for people, helping them get practical support they need. We know this work saves lives.
Okay.
And you've expanded it. You've expanded as well, Michael, haven't you? Life Rooms has got another base now.
Absolutely. We live just almost 5 years ago. Then we opened in Southport. We're at the heart of Hynd College in Bootle, but we expanded into South Liverpool Treatment Centre last year, and wonderfully into the Liverpool Playhouse Theatre as well. You know, the whole ability to use the cultural and creative campus that Liverpool's rich in to support people's health and well-being is just a dream opportunity. You know, to say, I don't feel so great today. Instead of taking a prescription or going to a clinic, I'm going to the theatre. You know, Liverpool has this creative spirit and uses its assets in really unique ways, I think, to respond to health and wellbeing issues.
Michael, there'll be a lot of people watching as well who might not just be worried about themselves, worried about other people. And I presume this help is there for them as well. For instance, we just had a question from Danielle on Facebook. Will there be more support for early years?
I think, again, Salome wants to talk a little bit about the support that's there around children and young people. Merseycare is actually the adult mental health services, but we do work extensively with younger people in a whole host of those support services. And I think, you know, one of the most striking things for me is, as a parent, is the impact to young children around this, that maybe they won't even be able to vocalise for years to come. That there needs to be a much greater emphasis on our children's mental health and well-being from day one. And I think, you know, partnerships between health and education, we're doing something of this with Hynd FE College, partnerships with health and education, starting the earlier the better, is the best possible way to turn the tide on this mental health crisis that we're so afraid of.
Great, Michael, thank you. Listen, we're going to put all that information, all those the details on the life room and the projects that Michael mentioned. We'll put all that online and on the screen at the end of this video. Salome, we'll bring you in and just hear your story, because you've got a really interesting story. You do some great work as well with Merseycare. You're a community mental health nurse and also the BAME network leader. Just tell us why you got in to mental health nursing. What prompted you to take on this career?
Thanks, Jay. I think I didn't even really know what I was doing, because actually when I was a student nurse, I thought, yes, I got this, because we primarily train in the medical model. Nursing is more, you know, about giving medication and things. But I was fortunate that the way I had my placements were in different places, and I learned more about the psychology of actually where mental health problems might arise from and how you might help people. So increasingly over the past 13 years, I've been qualified. I've become more drawn to seeing what else I can do more. So currently I work in the crisis resolution home treatment team, which actually covers the catchment area of all Merseycare, which Michael's mentioned, Liverpool and Sefton, all the way up to Southport at the far ends. So we provide home treatment and crisis support for anyone experiencing mental health problems.
Okay.
But I guess in my heart of hearts, as we were talking a bit earlier, when you help someone, it actually helps you in some way. It's very rewarding. And the best thing that I've seen from patients is patients actually maybe leaving mental health services altogether, fulfilling their dreams, their purpose, you know, going to university when they're young people. And that's the best thing you can do. And actually sometimes it doesn't even take a lot. Michael can probably tell you more about that service. Sometimes it just takes a kind listening ear, compassionate ear. someone should just have a place to be themselves and just say, do you know what, I'm really struggling. And I like Michael said, I think mental health affects everybody. It's a bit like the coronavirus. It's not about age, or although some people are affected more than others for various reasons, but it can affect everybody. And I'm glad that you are hosting this and helping us to share with people that actually you're not alone out there, because it's so common, and yet there was so much stigma around mental health and talking about it. It sort of doesn't make sense that there's stigma around it when we all lose people. Like my heart goes out to Jay right now and everybody who's passed away, not even from just COVID. It's just that it's been a really difficult time because you can't, bury your loved ones as you normally would. You can't even go to weddings, and you can't even happy things like people having children. You can't have your family at the hospital with you. So it's a really trying time, I think, for everybody.
A lot of people watching right now looking for some advice. They might have seen we were doing this and maybe they're feeling a little bit down the past few weeks, months, days. What would you say to anyone watching right now, Salome? What advice would you give them?
I would say we're in this together. If you think, oh, my neighbor looks like they're doing okay, you just don't know. And that's the challenge that I want to really bring up today is actually we need to speak up. We need to just talk to one another, because we are absolutely going through the same things together, and we can definitely give each other comfort, and we can help each other. And I might know something that maybe might help somebody, and I would just say, oh, why don't you do this? And sometimes it's not even help. I'm just going to touch on what Michael was saying again about socializing with people. There's been lots of things that's been happening, like the choirs online where people are joining together. Lots of people have started doing, I was doing it as well, quizzes where you just how we're doing it now. So now we're having a conversation, and it's brilliant. So it's like trying to adjust to the situation that we're living in. So it's important to try and be a little bit flexible and try and find new interests and new things. I don't know if you want me to talk about the services currently right now, because I work in a crisis team. I could tell you a bit more about maybe where you can get support when you're in an emergency mental health crisis.
We're going to put the details on at the very end. If you want to just briefly give us that information though, Salome, that'd be great.
Okay, so I think like anything to do with being unwell, it's better to not leave it till you're in a crisis. It's better to try and work on things before they get that bad. But if they do get really bad and you feel like you've become hurt, or someone might be at risk of getting hurt because of mental illness, I would recommend that you, at least if it's not imminent, you can go to your GP, because your GP can also refer you to the appropriate services. And whenever you come into contact with appropriate services, that could be via A&E, because there's mental health nurses as well in A&E. There's also mental health nurses that work with the police, for example. There's mental health services that work in the women's hospital. So there's mental health workers in almost everywhere, in social care, where it could be a social issue. So please just work with people, just talk about what you're struggling with, and someone will be able to help you. Okay. If you need medical attention, please go to A&E. And you will put the phone numbers up for how to speak to people. I just wanted to mention about the children's services, because Merseycare is a adult mental health trust, but we have CAMS, which is based at Alder Hey Hospital, which also provides emergency support for children up to the age of 18 years old. So that would be for anyone who knows any children that are struggling, because it doesn't have to be, it could be anything. Because I think children are just like little people as well, and they can have difficulties like anybody else.
Thank you so much. Listen, we're going to put all that information. We are running out of time, and we want to get Hope in as well. Thank you for chatting to us, Salome.
Thanks,
and Michael from Merseycare. We're going to just play a short video now. It's a public health message around mental health. It's all about exercise, this one. It's put together by someone called Hynd, and it's called Fit for Me.
I think being active just makes me feel happy. I feel that stimulation in my brain, and physically I just feel much better, more refreshed. I was diagnosed with PTSD, post-traumatic stress disorder, in 2017, and I found being physically active really helps with my mental well-being. I think with my condition, being active has shown me that I can clear my mind. finding something that you enjoy doing, that is really important, and then getting the support from family, friends and professionals. I found the right fit for me. You can too.
Big thank you to Hynd, great message, fit for me. And again, we'll share that. You can watch this full discussion back a little bit later, the full 30-minute discussion. We're going to go to someone now who's a lifestyle blogger, but also a big advocate, a big campaigner around mental health. Her name is Hope. Hope, hello.
Hi.
Tell us your story, Hope, because it's a really interesting one. I love it when people go through some of themselves and then use what they go through to really help other people, and that's exactly what you've done. Tell us about you and your story.
Yeah, so I developed anorexia when I was about 12, 13 years old. And it was like this voice in my head was like my best friend and gave me a real sense of purpose around everything, gave me this real value, a sense of control, and helped numb a lot of those emotions. I didn't realize anything matter with me when I first started it, and lived with it for the next 4 years. Eventually, kind of 4 years later, I started being an outpatient in CAMS, and then eventually was admitted to a mental health hospital, where I spent a year trying to recover, so learning about food, exercise, and learning to talk about how I felt. And I've basically been in an ongoing state of recovery since then, but decided about 4 years ago that I wanted to start publicly talking about it. I think quite often with eating disorders, there is a huge lack of understanding around them. We still judge eating disorders quite often on people's physical appearance and forget that it's a mental illness. So a lot of my campaigning work is around educating people, making sure people can access diagnosis and access support, but also making sure that when there is situations like a pandemic, actually we know those things that can be really triggering for people with eating disorders, and these are the best ways to respond in those situations.
You say triggered there, so it can be something. If someone is feeling a little bit anxious, they can revert back then, can't they, to that disorder they might have had in younger life?
Yeah, no, definitely. And what we've seen over the pandemic is this huge increase in people struggling with food. And I know actually personally for me, right at the start of the pandemic, even though I'm now kind of 12 years into my recovery, there were points that I found really difficult, from the stockpiling, so people going into the shops and buying loads of food. And if you've got an eating disorder, it was difficult to then kind of access your safe foods, so foods that maybe don't make you feel guilty. There was also this intense focus on exercise. And I think as well as the pandemic, we went through that period in the summer where lockdown eased a little bit before it picked back up again. Again, that whole focus on weight. And particularly with eating disorders, they thrive off isolation, they thrive off uncertainty. And when stuff like that happens, and there'll be people watching this evening that I'm sure it's happened to, you feel that kind of tug of the eating disorder, whether it's binge eating, whether it's bulimia, whether it's over exercise or restricting. And what the eating disorder does, it gives you that short-term value, and then you kind of long to go back to that, and then you start getting back into that quite dangerous vicious cycle. And because a lot of people are on their own, it's then even harder to access that support.
You've got some great campaigns. I love the names of them. Double the Scale, Kept the Count. It's all on your website. You just give us that website, because I think people will find it really useful in Liverpool, and certainly right now during this crisis.
Yeah, so my website is just hopevirgo.com. And yeah, my main campaign, which I really want to emphasize this evening, I guess, is the fact that eating disorders come in all shapes and sizes. And we need to start having more conversation. And as soon as you're worried about someone, or as soon as you yourself feel like your eating is getting out of control, don't wait until you've either gained weight or you've lost weight before accessing services.
Okay, Hope, thank you so much for joining us, and seriously do check out that website. It's something, Hope, I presume that you're fighting harder for, because there's a massive light on kind of mental health in general, but eating disorders sometimes left behind.
Yeah, I do feel like they are, and I think there's still a lot of stigma with eating disorders. We quite often think of anorexia as something that just affects white teenage girls, but we know it affects people of all different ages. It affects people from a huge different background. And I think, again, because I've been through it, I've been at that complete and utter rock bottom, and never thought I'd ever kind of get out of hospital. I never thought I'd be able to eat or not calorie count or let it kind of not rule my life. And I think that's partly what drives me as well, is the fact that there are so many people out there right now really struggling, who are so embarrassed about talking. And I totally get how difficult and how trapped they will feel, but those feelings pass. And if we start just showing a little bit more of that vulnerability to people around us, slowly but surely, we will start to build up that conversation. And definitely in Liverpool, like, it sounds like you guys are already doing a lot of that, where you're starting those conversations and you're able to then build up that support network across an entire city, which will then change like an entire nation when it comes to talking about eating disorders.
Okay, Hope, thank you so much for joining us. Check out that website. We put all the info out a little bit later. Thanks once again, Hope. We're going to leave the last word with Mayor of Liverpool, Joe Anderson. Joe, a really useful discussion this evening. Hopefully a lot of people watching will have taken something from it. Yeah,
I think we probably, one thing I've learned is that we need to have a lot longer to discuss the issues amongst ourselves. You know, I mean, Salome and Mike gave lots of information there. Hope gave lots of information, and you know, there are many organisations out there. It was great that you talked about how Hope uses their experience to actually give life to the subject, if you like, and because she's been through it. I mean, Jake Mills and Chasing the Stigma does exactly the same thing, because he's gone through mental health issues himself, and suicide attempts and thoughts, and he set Chasing the Stigma up. And then there's, you know, for many other people affected by you know, suicide, there's Paul's Place. There are many organisations across the whole city. So maybe we need to do another one in a couple of weeks' time, where at least we're having a conversation and discussing with things. So it's great that we're putting information out on the website about places to contact, but just having the opportunity to discuss and get people who run some of these facilities to talk about how you can make contact, how you can engage. You know, when we talk about child's mental health and stuff, children's mental health, of course, we've got, as is rightly being pointed out, CAMS. We've also got our own children's centres, which we've kept open in the city, despite the challenges that we face, where people can go to. So I guess the comfort that I'm taking from this is that there's a lot of support out there. What I want to make sure is that we communicate with each other, so people understand where to go and how to get it, and how to at least take that first step. Just one final point from me, Jay, about mental health and about the stress and anxiety. You know, look, I was 21.5 stone 7 months ago, 8 months ago, as we started lockdown, and I decided that I wasn't going to just, you know, be because I was shielded. I wasn't going to be sort of, so I decided to get myself fit, go on a diet, eat sensibly. I've lost 3.5 stone, and now I'm doing the couch to 5K. I've had to stop for a week because I've done me calf muscle, but I'm doing the couch to 5K. I recommend it to anybody. As a 62-year-old old fella who was 21.5 stone, if I can shed 3.5 stone, and I'm going to continue to keep going, if I can do it, I believe you me, it makes a huge impact to not just your physical well-being, but your mental well-being, your mental health well-being. Please do it. And you know, that Fit For Me campaign, Couch to 5K, get on board with it, because it really does make a difference.
He's doing Couch for 5K this year. Next year, I think he's promised to do the Santa Dash in 2021.
Yeah.
Rock and roll marathon. Yeah. Joe, thank you so much. Mayor of Liverpool, Joe Anderson, being open and honest with us this evening. You can get lots and lots of help, lots of support and advice. As we mentioned, Merseycare is a great hub for this. As Michael mentioned, we got the Zero Suicide Alliance, also Life Rooms and Talk Liverpool as well. And a really important phone number, which you can see on screen right now, is 0800 145 6570. That's an urgent mental health support line that you can use whenever you do need to. Again, we'll share all these details, all this contact information for these incredible support groups. A huge thank you to our guests, to Michael from Merseycare, to Salome for sharing her story, and also to Hope Virgo. Check out her website as well, and of course to the Mayor of Liverpool and the team back in the Liverpool City Council offices putting things together for us this evening. We'll share this video on the Guide Liverpool, and we'll speak to you next time. We're going to leave you with an important message from Councillor Paul Brandt from Public Health Liverpool. Take care.
This year, more than any other, I think the wider community is aware of the importance of our individual and collective mental health. Many individuals social isolating, dealing with the fear of the pandemic, and seeing the impact of not being able to have as much human contact as they have in the past, mean that their mental health is more under pressure and stress. It's really important that collectively we look out for each other, that you have that telephone call, that Zoom call, that WhatsApp message with your friends, your neighbours, to check they're okay, and to put a metaphorical arm around their shoulder to say things are going to be all right. We will get through this together. We're here supporting each other, and Mental Health Week is an important moment for us as a wider city and a wider nation, and indeed the entire global humanity, to appreciate the importance of not just physical well-being but our mental well-being. So this is a time to be kind, to understand and to look out for each other.